Hi, I'm Dr. Anna Saylor with Every Family Chiropractic Center, and today just a quick tip about things and how your cranial bones can affect your body. So one of the coolest things we do here at Every is we actually can adjust your cranial bones, and most people don't even think like, my cranial bones, how can you actually adjust them and how do they actually get out? But one of the big things here, so we're just going to here is your skull. And we like pink here at the office, so everything's painted pink. But this actually shows you when you're born, your cranium is not fused. So if you think about your children or when you were a child, the soft spots are the fontanelles where your cranial bones are not fused. And as you age, they start to fuse, and they lead to things like sutures. But they actually are mobile. So every time you breathe, every time you move, they actually flex a little bit. And a lot of times people are like, well, how would you affect your cranial bones, or how do you hurt your cranial bones, or how do they get out of the right position? If you think about your lifetime of how many times have you hit your head, or if you're watching a child walk and how many times are they whacking their heads or falling down, or just think over the last week, how many times did you do something you're like, oh, that's going to leave a mark, or oh, that doesn't feel good, or all those things can actually affect your cranial bones. So just a quick little thing. I'm going to go kind of through your different cranial bones. The coolest bone, my favorite bone, is the sphenoid. So right here. The sphenoid is a little bone right behind your eye. And sphenoid means butterfly. So if you were to take the skull, the sphenoid is this little guy here. And it actually is shaped kind of like a butterfly, which is why it's called the sphenoid. But it actually articulates with all the other bones in your skull. And what's so important about your skull? It houses your brain. And this whole, your spinal cord and your spinal column. So everything is controlled from your brain through your nervous system down to the rest of your body. So every organ, every cell, every system. Chiropractically, we use a technique called KST, which is basically a technique that, I can't get the head back on, can work directly on your cranium. So by doing that, we use this little tool. It gently taps the cranial bones into the right position. So if your sphenoid's off a little bit, I can just gently come in and tap in. I keep going the wrong way. Or if your parietals are off a little bit, I can gently tap them. And I have this cool poster, so the next time you're in the office, you can kind of look at what we're talking about here. But sphenoid, let's just kind of hone in on the sphenoid. Sphenoid, what can it affect? If it's off on both sides, we know that you're not sleeping as well as you should be. For some reason, when you don't get deep sleep, your sphenoids actually go off on both sides. So if you're in here and we're adjusting your sphenoids and they're off on both sides, I know you're not sleeping very good. And a lot of us are not sleeping very good, or we're not getting the deep sleep we need. So by adjusting those, the number one side effect we see is that you sleep better. But sphenoids, correlations between structures and health. If you look at all the lists that sphenoids can affect, so we see migraines and headaches and sinuses, and there's a whole list here, brain fog. Associated your cranial bones affect your cranial nerves. So sense of sight, smell, taste, all the nerves that run through your cranium can be affected by your cranial bones too. So I just wanted to kind of do a quick tip on when someone says like, why do you adjust my head, or why are you actually touching my head? It's because we're actually adjusting your cranial bones, and all your cranial bones can be off in a different position. So it's the number one thing we do here at Every. So if you have any more questions, the next time you come in, ask me or ask the other docs, and we will be happy to go through it with you. And if you have any questions, just send us a message too. So I hope everybody has a wonderful weekend. I will see you soon. Have a great weekend. Bye.